Imagine waking up one morning and noticing that your clothes feel looser. At first, you might think it is just a change in your routine. But sudden weight loss in seniors can be a warning sign. When our bodies lose weight unexpectedly, it might mean that something serious is happening inside. Experts say that unexplained weight loss can be a sign of cancer. I once met a gentleman who lost 10 pounds in a month without any change in his diet. His doctor later discovered an early stage of cancer. It is a moment that shakes you to the core and urges you to seek help immediately. Now think about those days when you feel drained despite a full night of sleep. Persistent fatigue is not just about getting older, it can be a red flag. Many seniors experience tiredness, but when fatigue lingers and worsens, it becomes more than just a part of aging. Research from trusted medical institutions tells us that constant exhaustion might indicate that our bodies are fighting an unseen enemy. I remember a friend who always joked about being tired until his energy levels dropped so low he could barely keep up with his daily walk. When he finally visited his doctor, the tests revealed an underlying cancer that needed prompt treatment. Another sign that many ignore is the presence of unusual lumps or swellings. These small, often unnoticed bumps on the neck, underarm, or groin can be the first signals that something is not right. I heard the story of a woman who discovered a small lump during her routine self-check. She brushed it off at first, but soon it began to grow. Her doctor explained that these lumps could be swollen lymph nodes fighting an infection or something more dangerous like cancer. Such stories remind us how crucial it is to monitor our bodies and report any changes without delay. There is also the matter of persistent pain that simply refuses to go away. While occasional aches are normal, continuous pain that does not improve can be alarming. Many seniors experience discomfort, but when pain persists without a clear reason, it is time to listen to your body. I recall a veteran who ignored his chronic back pain for years. He believed it was just part of aging. It wasn't until the pain became unbearable that he sought medical advice, only to find that it was an early indicator of a deeper problem. His experience teaches us that pain is our body's way of telling us something is wrong. Changes in our skin can be a silent alarm, too. New moles, color changes, or sores that refuse to heal might appear harmless at first. However, trusted health professionals warn that such changes can signal skin cancer. I once spoke with a survivor who had noticed a small spot on his arm for months. He thought nothing of it until the spot grew and changed shape. A biopsy confirmed it was skin cancer. His battle, though hard-fought, started with a simple observation. This story is a reminder to check our skin regularly and never dismiss these subtle changes. Then there is unexplained bleeding or discharge, a sign that many find too embarrassing to talk about. But ignoring abnormal bleeding can be dangerous. Whether it comes from the gastrointestinal tract, the urinary system, or elsewhere, any unexplained discharge should be taken seriously. I learned of a case where a senior ignored minor bleeding from his digestive tract, attributing it to a minor irritation. When the bleeding continued, he rushed to the hospital. Doctors later revealed that the bleeding was a symptom of a cancer that needed immediate treatment. This incident underscores the urgency of acting quickly when unusual bleeding occurs. A persistent cough or hoarseness might seem like a common cold at first, especially for those who have spent years smoking or living in environments with pollutants. Yet, when a cough lingers for weeks and the voice becomes strained, it is not something to ignore. Trusted medical sources have long warned that such symptoms in seniors could indicate lung or throat cancer. I once heard of a retired teacher who had a cough that would not go away. She tried various remedies, thinking it was just an ordinary cough. But as her voice grew weaker, she sought medical advice. The diagnosis was a wake-up call that showed how a seemingly minor symptom could hide a serious threat. These 7 signs may appear subtle at first, yet each one carries a heavy warning. They are not meant to scare you, but to empower you. Your body sends signals every day, and it is up to you to listen and act. The stories of those who ignored these signs and faced the consequences are a somber reminder of what can happen when we fail to pay attention. They are also a call to action, a call to check in with ourselves and to not delay a visit to our doctor when something feels off. Your health is the most important asset you have. Early detection of cancer can make a critical difference in treatment and recovery. Do not let fear stop you from seeking the answers you need. If you notice any of these signs, a sudden drop in weight, unyielding fatigue, unexpected lumps, continuous pain, changes in your skin, unexplained bleeding, or a persistent cough, reach out to your doctor immediately. Remember, these symptoms do not automatically mean you have cancer, but they do signal that it is time for a closer look. This is not a message to alarm you, but to remind you that you are not alone in this journey. Many have faced these challenges and emerged stronger by acting early. The importance of regular checkups, open communication with your healthcare provider, and paying close attention to your body cannot be overstated. It is our hope that by sharing these stories and signs, you will feel a sense of urgency and take the necessary steps to protect your health. Your life matters and every moment counts. Stay vigilant, stay informed, and never hesitate to act on your body's signals.